Hey, everybody. Welcome back to the podcast. I'm trying something new today and actually recording a YouTube video of myself doing this podcast. Don't mind me recording in our guest room right now because, the kids are awake. They're out there. It's Sunday. Vito's out there. It's the only room that has decent lighting and is the quietest room in the house. So Vito is building me a recording little studio that I'm so excited about and I can't wait to record in. I wanted to do a deep dive. I had so much fun doing a deep dive before with you guys. And I know that I talk a lot about actually I don't talk a ton on here, probably more on Instagram, but if you've been listening to the podcast for a while, you probably know my stance on medical interventions in birth and things like that. I definitely think that they are necessary, that they save lives, that it's really, really important. But it is way overused. And that is what the research is showing us now. A lot of OBs are going to whip out the ARRIVE trial and say, look, they did this trial. And if you induce at 39 weeks, it decreases the cesarean rate. However, there's so many things that you can pick apart in that. And a couple of things that I want to highlight in that is that their overall cesarean rate before the induction group. So the induction group had an 18% cesarean rate. The overall cesarean rate of the people who didn't get induced was 22%. So that is still well below the national average. So how did they achieve these results? They were using different induction techniques. They knew that they were being monitored. They knew that they were being researched. And so they followed certain things certain ways. That is not how most hospitals practice. Most hospitals that you're going into have a 30-some% C-section rate. Most practices have that. That's the average in our country. And doctors are using induction methods that aren't necessarily great. So people going into this trial, before they'd get induced, they would take their Bishop score, which is going to see how favorable your cervix is for induction. And if you didn't have a favorable cervix, they weren't going to attempt this on you. That doesn't happen in real life. They're still going to try to attempt certain things. Also, just the way that they followed it and knew that they were being watched, the numbers that they achieved are not the numbers that we see in the United States overall. So there's other things that you can pick apart with this trial where it just doesn't really make sense. And when you actually look at it, inductions lead to higher C-section rates. And there's a ton of research that actually supports that. However, inductions are necessary sometimes. And so I wanted to talk today about a couple reasons to get an induction. Because like I said, I know that I talk a lot about having a big baby is not a reason to get induced. Being over the age of 35 is not a reason to be induced. Having a high BMI is not a reason to be induced. These are not an individual risk factor that automatically puts you up for induction, but that is how we are treated in our maternal medical model, in the obstetric model of care. And the research supports that and actually shows, again, with big babies and gestational diabetes that it leads to higher C-section rates. So, and there's ways that there's things you can do to reduce cesareans, which actually I'm really excited. You guys mark on your calendars, July 26th, I am going to be doing a free webinar on 3 things to include on your birth plan to reduce your chances of having a cesarean. And it's going to be just a lot of great information. It's free, so sign up. If you can't make it to the time, you're going to be given a recording afterwards. And then I'm also going to be talking about my program that I'm launching on how to get you informed and empowered on this research, on the different decisions, so you can make the decisions for yourself and not have providers doing it for you. I think that providers, again, are great at their jobs. If you need a C-section, you are getting a very well-trained surgeon, but you also have a high-risk surgical doctor who's assessing low-risk people. So that's where we're seeing the disconnect here. So yeah, I thought it'd be very interesting to talk about a couple of reasons to get an induction. The first one that I want to talk about, and also, sorry, before I dive into this, I did do a Q&A on Instagram, so I am going to be answering all of these questions at the end of the podcast, and then filling you in on some stuff going on in my life. This last week, we had our ultrasound for the baby, which was exciting. And yeah, so I'll be answering all those questions at the end. And then we do have a couple of sponsors for the podcast. So I'm going to talk about those as well. I'm going to mention the first one now. I don't know if you remember me talking about Mosh. So they are an amazing protein bar, and they are a smart snack that keep your brain and body fit and fueled and feeling good. I know if you've been following me, you know that I talk about how important it is to get enough protein, especially in pregnancy. And so having a high protein snack with you is really, really important. I am on the go quite a bit, even though I get to stay home a lot. We've had so many appointments. It's summertime. We're also out and about a lot. So having something with me that I can grab and snack on is so good. And that is where Mosh comes into handy for me. Again, they have high protein. They also have things in there that support brain health, like ashwagandha, lion's mane, collagen. You know, I love collagen, omega-3s, and it's low sugar intake. So it has a good, healthy balance for your body. And it not only does it help you fuel your energy for the day, but fuels your brain. It was founded by Patrick Schwarzenegger and Marie Shriver. Mosh is on a mission-driven brain health and wellness company that donates a portion of all the proceeds to support women's brain research through the Women's Alzheimer's Movement at the Cleveland Clinic. So that's another reason to support them. I love the blueberry flavor. That's my favorite right now. I switch it up a lot. I feel like there's seasons that I go through where I love chocolate stuff and then I don't, but I'm always a fruity person. So like blueberry, lemon, anything like that, I'm going to go for. Not only do I love it, Vito does as well. So any easy snacks that I can have on the go with me, I always have a snack pack for the kids. And now there's a couple of things in there for me as well. So head to moshlife.com/Chava to save 20% off plus free shipping on your first 6-count trial pack. That's 20% off and free shipping on your first 6-count trial pack, which includes all 6 mouthwatering flavors. That's moshlife.com/Chava. All right. I'm going to dive into a couple of reasons to get an induction. So one of them is going to be what they call IUGR, which is intrauterine growth restriction. So this happens when your baby is not growing as it's expected to. It's not as big as it would be for the stage in the mother's pregnancy. And the timing is known of when the baby was conceived. So there's a few ways of measuring this. The first indicator is going to be when they, at like one of your appointments, when they're doing the uterine fundal height. So they are looking for how big your uterus has grown. So they're going to measure from your pubic bone up to the top of your uterus. That usually measures with how far along you are in pregnancy. For example, I'm 22 weeks. I just had an appointment this last week. I was 21 and a half at my appointment, and that's like exactly what my fundal height was. However, it's not always exact. It can be a couple weeks, give or take. But if it's more than that, they might want to do some further intervention to make sure that the baby is getting the nutrients and the everything that it needs to keep growing. So if your fundal height, let's say you're measuring pretty far behind, they're going to want to do a prenatal ultrasound to check. And that's usually how it is diagnosed, how IUGR is diagnosed. There's a few things that can put you at risk for this. So if you smoke, drink alcohol, use drugs, those are things that definitely restrict baby's growth. If you have an underlying infection that maybe you don't know about, that can definitely cause fetal growth restriction. And then certain medicines. So it's really important to know if you are on certain medications, if it can affect your pregnancy, make sure that you always disclose everything that you're taking with your provider so that you guys can have that conversation. I guess there's some like seizure treatments that can cause some issues. If you have a medical condition, like clotting problems, anemia, lupus, that can put you at risk. High blood pressure, hypertension could potentially affect this. Having a baby that has a genetic disorder or a birth defect can also cause this, or being pregnant with multiples is also a risk factor for this. So they'll want to do a prenatal ultrasound. And if you've heard me talk before, ultrasound dating late in pregnancy can be highly not accurate. But these ones are usually occurring before, and they're looking more for that small baby versus telling you that you have a big one. And there's other things that they're going to check for the small baby. What they're going to do is also look for problems with the placenta, for things going on maybe with the umbilical cord, for low levels of amniotic fluid, and different things like that. Like I said, the size of the baby might not be completely accurate, but it can help the provider track the baby's growth to see if there's a problem. So if they start tracking to see if the baby's looking bigger during each ultrasound, that will help them do that. So they're also going to monitor the baby's heart rate, movements, and then screen you for infections and things like that. Potentially do an amniocentesis to look for genetic causes, and to maybe even see how mature the baby's lungs are. So in amniocentesis, they're going to actually inject a needle into your uterus to get these results. So it is a little bit invasive. There are some risks with that, which I'm not going to go into right now. But the best thing that you can do, so if you have IUGR, I'm pretty sure they call it IUGR. There's a name for it. You don't have to say the abbreviations each time. Is that the doctors are going to want to monitor you closely during your prenatal visits with ultrasounds, tracking growth, and watching for any other problems that could potentially arise. If you end up having some conditions, doctors can try to help you manage that. And sometimes it might be like a diet thing. Let's say you've been extremely sick your entire pregnancy. You can't eat a ton. So maybe they're going to help you do some diet changes, eating healthy, adding nutritious foods to your diet, and making sure that you're gaining enough weight in your pregnancy. And then sometimes induction will be recommended. So the reason why induction is recommended like this is if the baby is not growing the way that it's supposed to, and let's say there is a placental issue or an umbilical cord issue, and they're not getting the nutrients they need, at this point, they are better off outside of your womb than in it. And that is why this could be a medically necessary reason for inducing. So there's something that's not working right, and it's safer for them to be outside than inside. And that is why you would get medically induced for IUGR. This can definitely happen, and there's oftentimes like there is nothing wrong, but there are times when there is. But there's other things to like keep in mind with this, because I've also had friends who their doctors have told them your baby's really small, all these different things, but they were also both really small people. So she was barely 5 foot. He's like 5'4". They're both tiny humans, and both their babies were like 5 pounds something, full term and very healthy. They're just small people, so they have small babies. So there's things like that to take into consideration too, to like maybe not be scared, but this is something that can come with risks that can require a medical induction. As with everything, I always recommend that you do your own research, that you figure out for yourself what risks are there, what's not. You can always get a second opinion. So let's say you go to one provider that's like, it looks like your baby's measuring small. I feel like we need to do more tests, and you can do more tests, but then you can also go to somebody else and say, hey, listen, like, what do you think about this? Like, do I actually need to be induced? or not. So that is, again, a reason to potentially be medically induced. A few things that can happen. Babies that have fetal growth restriction are more at risk for other kinds of problems, like just being born early on their own. That's your body's way of saying the baby's going to be healthier outside than inside, and are at higher risk for needing to go to the NICU. Sometimes there's other things related to it, such as breathing and feeding issues, trouble regulating body temperature, abnormal cell counts, blood sugar levels, fighting off infections, neurological problems. But the risks that you're going to see are going to depend on the issue that caused the problem in the first place in the uterus. So that's also why further testing is good, the amniocentesis, to see like if there is potential birth defects, so that also people can be on staff equipped to help your baby when they are born. And the best thing that you can do is to go to your prenatal appointments, to have this testing done, to make sure everything's okay, make sure that you are nourishing your body, keeping a healthy diet, getting enough sleep, and of course, avoiding smoking, drugs, alcohol, and things like that. I'm going to include a couple links in the show notes for this, just so you guys can read some on your own as well. I know that some people have reached out to me before and been like, hey, what about this issue? What about that? And again, I'm going to say this with like every single thing ever. There's not a one size fits all. So I'm actually really excited. I'm going to interview somebody soon about risk, because there's so many things that just put you automatically into a risk factor category. And that's not necessarily true. Like I said, if you have a high BMI, you're at risk. You have gestational diabetes, you're at risk. You're over a certain age, you're at risk. That one single risk factor does not define your pregnancy story or your labor and birth. And so it's really important to know this information so that you know how to combat it. Your race, that is a risk factor. You're going to be treated differently. You're going to have different risk factors depending on your race. So that it's important, again, to have information so you know what puts you at risk. So I know I'm over 35. That puts me as advanced maternal age. That puts me into a certain category. So there's different things at the end of pregnancy that are going to arise. They're going to recommend more testing. They're going to recommend, I come into non-stress tests starting, I don't remember exactly what it was, like 37 weeks, 36, 37 weeks. With my last pregnancy, I declined. I literally turned 35 1 month before I had Doula. And so I decided at 39 weeks to go in for a non-stress test. I didn't start at the 36, 37 weeks. But there's going to be other things that are recommended. But there are a lot of providers that say, hey, you're 39 having a baby, we're going to induce you at 39 weeks. However, you having the information, the research to make assessments for yourself, there's women who are 39 years old that are healthier than some 25-year-olds. There are people with high BMIs that are healthy. Your BMI is not an indicator of health. It's just not, especially in pregnancy. Don't even get me started on the health, I'm doing quotation marks for those of you that are just listening and not watching, but the healthy weight guidelines for pregnancy are so inaccurate and not founded in research at all. And I can't tell you how many people I've talked to who have said their providers have made them feel like crap because of how much weight they've gained in pregnancy. And that just like pisses me off, because that's not an individual factor. Some people need to gain 50, 60 pounds in pregnancy to have a healthy pregnancy. Other people might not need to gain that much weight. But as long as you're not just treating pregnancy as an excuse to eat like a dozen donuts every single day, which I haven't met anybody who's done that. I feel like I grew up in a generation when they're like, oh, we're eating for two or just whatever. But you don't really like see that or hear that now. And I think we all know you're not actually eating for two, but your nutritional needs are different. Like this is like a little tangent, but you guys know that I go on these all the time. I've never, ever followed the weight gain curve in pregnancy. I remember in one of my pregnancy apps, because I have like 5 on my phone that I check, they're like, at this point in pregnancy, you've probably gained 5 pounds. And I'm like, what? I'm like, I've gained like almost 20 pounds. So I don't know what these people are saying about this. Because I've also never in the first trimester really lost my appetite. I have towards certain foods. I've had very strong food aversions, but I very much have felt the need to like nourish myself and continue to eat. And I know other people completely lose their appetites, and that sucks, first of all. And secondly, you got to try to get some nutrient dense foods in there, but that does affect weight gain in pregnancy. So you aren't going to gain as much weight as somebody else. However, those guidelines are very, very inaccurate. And if you have a provider making you feel bad about your weight gain in pregnancy, honestly, just whatever they say, toss it out the door. Again, unless you're the only person who knows this, that you know that you're just like chugging a gallon of Coca-Cola and eating a ton of donuts and whatever. That doesn't mean that like, obviously that's not good, but it doesn't mean that if you're like, oh, hey, I'm craving fries today, that you go get fries. That's okay. You can do that. There's nothing wrong with that. As long as you're also getting some good, healthy, nutrient dense food in there as well. I definitely have, this has actually been my pregnancy that I've craved the healthiest foods. In my first pregnancy, I craved Portillo's fries and cheese sauce, and I would just like go get extra cheese sauce to bring home to dip things into. And I tried making a healthy version of the cheese sauce, and it was okay. It could like kind of hit the spot sometimes, but it didn't even come close. I was like, I need the real deal, which is actually, I'm pretty sure, really fake cheese sauce. But I let myself have that. I didn't eat it all the time every day, but if I was like, ooh, that sounds really good, I'd go get it. I'm also not a Coke drinker normally, but in my pregnancies, every once in a while, I'd be like, ooh, I just want like a fountain Coke. And I would grab one. And this has, again, been my like least, this has been my pregnancy where I've probably eaten the least amount of fries or drank the least amount of Coke, but I also get in great nutrient stores. If you guys follow me on Instagram, you know that I love nourishing my family. I love cooking. I love getting in really nutrient dense foods, but that doesn't mean that I also don't enjoy other things as well, because I totally do. But all of that to say, I've always gained more than the quote unquote weight gain recommendations in pregnancy. So your BMI is not a risk for certain things. It does put you at risk, which again, I'll dive into this more in another episode, because the obstetric model of care sees you as a risk. But people with higher BMIs actually have way better outcomes in the midwifery model of care. So in birthing centers or in home births, because they aren't treated as just one risk factor because of their weight. So all of that to say, there's a lot of reasons to not get induced and to know your options and the research and what really does put you at risk. But again, today I'm just sharing a couple of things that I believe are reasons to get medically induced. And I'm not saying that these 2 things that I'm talking about are the only 2 reasons. Again, it needs to be individualized. I don't know your situation. I don't know your health history. I don't know what else is going on. I'm also not a medical provider, but I do study the research. I learn from so many people who are. And so again, I'm just talking about a couple of things today. Also things to prepare you for. I feel like there's so many things in pregnancy that you don't know can arise that can happen. So let's say you have in your mind, I'm going to have an unmedicated birth where I spontaneously go into labor, and this is exactly what's going to happen. That's a great if you want that. And there's ways that you can prepare for that and things that you can do, but sometimes there are things that happen that are just out of your control. And having the intrauterine growth and restriction is one of them. Like nobody plans for that to happen. There are things that just happen, but it's good to know, hey, like this is something that could be potentially serious, that maybe we really want to consider a medical induction at some point if life on the inside is maybe not getting them everything that they need, and it's better if they're outside. So it's good to know some of this. Another thing that it puts you at risk for for a medically necessary induction that is highly recommended if you have this to get induced is preeclampsia. And preeclampsia is often comes with high blood pressure, so a hypertension disorder that occurs during pregnancy. It's one of the hypertension. So there's a lot of different hypertension things, and hypertension in itself can be a risk factor that puts you in that potentially needing a medical induction in pregnancy. But preeclampsia is one of them. There's gestational hypertension as well. However, with preeclampsia, there are a few things that they're going to check. So high blood pressure is going to be one of the big signs that they're going to see. And later in pregnancy, they also start testing for protein in your urine. A lot of times this preeclampsia doesn't develop till after 20 weeks of pregnancy, but it can lead to serious, even fatal complications for moms and babies. This is also one of those risk factors, again, that comes with race. So Black women are much more likely to have preeclampsia. And that's also where we're seeing like Black women have a much higher chance of maternal death in the United States. And preeclampsia is just one of those issues. The issues run much deeper and more than that, but that is one risk factor. So if you are a woman of color, they're going to put you into a certain category. Does that mean that you're going to develop this problem? No. Does it mean that you are an automatic risk factor? Absolutely not. However, if you do develop preeclampsia, there is a lot of things, there's a lot of reasons to be medically induced. So again, like I said, it can be potentially fatal. So the high blood pressure and protein in the urine are the key features that they're going to look for. Swelling can be one of them that I know a lot of us can get a little puffy later on in pregnancy, but this swelling is a little bit different. My sister actually had preeclampsia with her second, and she got induced. And her feet legit, and my sister's a tiny human. Like before she got pregnant, she'd blow away in the wind. Pregnant, she gained quite a bit of weight, but her feet were so swollen, like it was like her calf just went straight down into her leg, like her calf muscle. She was so swollen, retaining so much water. And so that was really crazy to see. That was like my first exposure to preeclampsia. However, the biggest treatment that they're going to do for it is induction. And it usually resolves with the birth of the placenta. So preeclampsia is kind of attached to the placenta and the health of it. And there's different other things. There's actually really like a ton of different research coming out about things that you can do to potentially reduce the risks of preeclampsia. And one of them is eating high protein diet. So the brewer's diet, looking into that, it's having at least like 100 grams of protein a day, which is really, really great in general in pregnancy to do. That helps reduce blood pressure. It helps reduce the risk of different hypertension disorders and things like that. There's a lot of things about the health of the placenta. So one thing that I've recently heard is that the sperm, is responsible for the placenta. So it could potentially come from the sperm, which is very, very interesting, which is also why I always preach sperm health, sperm health, sperm health. It's not just you who should be giving up alcohol and whatever to try to get pregnant. And for pregnancy, your partner should be doing that too, because this baby is 50% theirs. So if they're smoking and drinking all the time, that's your baby's genetics. So it is really important for them to be a part of this as well. I want to share with you a few signs and symptoms that you may have preeclampsia and that you should talk to your provider. One of them is going to be weight gain over 1 or 2 days because of large increase in fluid in your body, shoulder pain, severe headaches, dizziness, trouble bleeding, or trouble breathing, not bleeding, vision changes, and things like that are going to be symptoms that you're telling your provider about at every appointment. Toward the end of pregnancy, if it's worsening, I would call them, because again, preeclampsia is something that is very, very serious. It can be fatal. It can cause seizures. Preeclampsia, like I said before, usually resolves with birth. Like that's the only cure for it when you have it. However, it can last after, or it can be onset after, which is much more rare, but can also happen. So that's like something to look out for. Although the cure for it is birth, it doesn't mean that it's not potentially preventable. I'll link some of Lily Nichols' work on here, Dr. Lily Nichols. She actually has a whole diet guide for preventing preeclampsia and high blood pressure disorders in pregnancy through nutrition. So it depends on like what stage you're finding out about, but the more that you can prevent it would be the better. So having great nutritional stores and making sure that you are taking a high quality prenatal. You guys know that I love the Needed brand, but making sure that you're getting in a lot of great protein, a lot of great nutrient dense foods is so important. And it's like a stupid game of like, hey, you're in pregnancy and things don't sound good to you and you get sick, you get nauseous around these foods, but hey, your body vitally needs them to have a healthy pregnancy. It's like, what the heck? Like, what kind of design was this? In pregnancy, shouldn't we be craving all those great nutrient dense things to keep us and the baby healthy? But that's just not always how it works. But it's great to have the education and the resources and the knowledge on it. So yeah, the other risk factors for preeclampsia is a teen pregnancy or someone over 40, being African American, being pregnant for the first time, having babies less than 2 years apart or more than 10 years apart, pregnancy with a new partner instead of the father that you've previously had kids with, which is just crazy. Listen to this. This one lady had preeclampsia with her first 2 kids, got divorced, remarried, no problems with preeclampsia with the next one. So like I said, I think that there's something to the sperm health and the placenta that goes into this as well. If you have high blood pressure before getting pregnant, a history of preeclampsia, mother, sister, people in your family who had it, a history of obesity, carrying more than one baby, IVF can potentially put you at risk for this, or a history of diabetes, kidney disease, lupus, rheumatoid arthritis. I don't know why I can't say certain words right now. But these are going to be some risk factors as well. Again, it's one of those things. It says that preeclampsia is kind of rare. I feel like I've been seeing it more and more, not necessarily preeclampsia, but hypertension issues, which when I speak to other providers, they're saying that they're seeing this more and more too over the last few years since COVID happened. So I think that COVID has really affected our maternal health care. If you didn't see that research that came out about our maternal deaths have greatly increased from 2019 to 2022. And so it's like, why? Why has this happened? Was it because people weren't allowed to have partners in with them birthing? They were treated different. They were separated from their babies, the stress of the pandemic, all these different things. But we are seeing, when I talk to providers, I was actually just asking somebody, because as a doula, I'm like, hey, all these people that I know that I'm referring to give birth at these certain places are ending up getting induced early for hypertension. Like, what's going on? Is this practice just not practicing as good as they used to, or are we actually seeing higher rates of hypertension? And she's like, no, we're seeing a lot higher rates of hypertension coming in. So I'm not exactly sure what that reason is. Like I said, I think stress is huge. And I'm not sure like the other things, but it is a risk factor. And the rare complications that can come from it and the reason why it is medically necessary to induce is because it can cause stroke, it can cause a seizure, fluid buildup in your chest, heart failure, reversible blindness, bleeding from your liver, and bleeding after you've given birth. So it can damage your liver and blood cells. You can get a complication called HELP syndrome. That stands for hemolysis, elevated liver enzymes, and low platelet counts. So there's a lot of other things that can happen. And again, so if you have blurry vision, chest pain, headache, fatigue, swelling in your face and hands, bleeding from your gums or nose, that can be a huge, you need to call 911 because that's HELP syndrome that can come from having preeclampsia. Preeclampsia can also cause your placenta to suddenly separate from your uterus, which is called placental abruption, which can lead to stillbirth. So there's a lot of risk factors that come with preeclampsia. I'm actually going to see if I can pull up the numbers of how common this actually is. Let's see, preeclampsia. Because I feel like it says 1 in 25. So 1 in 25 about. And then other hypertensive disorders, 5 to 8%. And then there was an observational study, which I can include in 2022, where 52 out of 600 patients had hypertension in pregnancy, and 32% were preeclampsia causes. So 32% of the hypertension, so about 1 in 25. So, I mean, I think that that's pretty common. Not super common, but I mean, I feel like we all know somebody who has had it. And again, it's one of those things that is a medical necessary reason to get induced. As you know, I don't believe that there are tons of medically necessary reasons to get induced, but the two that I shared today, I truly believe are, and they're not the only ones. I'm not just saying that these are the only two reasons you should ever get induced. I'm not saying that at all. But just so that you have knowledge of, hey, these things can arise at the end of pregnancy. And let's say I have my mind set on, no, I'm doing it this way. And this is exactly how I'm going to deliver. And this is what I want. I'm not saying that you don't always have choice and agency over your pregnancy, but these would be two things that you're like, hey, listen, like my plan might have to change and that's okay. Like I need to be okay with that. So I just wanted to share, again, a couple of reasons with you. I know that I'm always saying, this isn't a reason to get induced. That's not a reason to get induced. So these are reasons to get induced. All right, we're going to hear from one more sponsor before I dive into the Q&As. And it's going to be Jenny Kane. You guys have already heard me talk a lot about Jenny Kane because summer is here and my wardrobe could always use a refresh. And Vito and I have actually been just like purging, getting rid of stuff because things just accumulate. And I had something pop up on my timeline the other day of like, here's this photo. And I was wearing this outfit from 10 years ago that I still have in my closet that I don't know if I've worn since. Like, because I don't know. We all have those things. And I'm at this point in my life where I just need to eliminate and I only want like minimalist, effortless, but totally classic pieces that can go with anything. And that's where Jenny Kane comes into the picture. So with any season, especially this one, their dresses are amazing. I'm obsessed with the Cove dress and the road dress for summer occasions. And their new day dress is quickly becoming an everyday go-to uniform. And that's why I love it, because you can rewear the items. You can dress them up, you can dress them down, you can throw on a jacket. They are just staple key items that you're going to wear over and over that are totally worth the investment. One of my favorite is their cozy hooded cashmere sweater. As soon as, I mean, it's too hot right now, but literally as soon as I get wind of a little breeze in the fall peeking around the corner, I'm going to whip out again, because it goes with everything and it's so cute and the softest thing that I've ever put on my skin. But if you're looking to revamp your closet and just get some classic staple pieces, Jenni Kayne is going to be where you're going to want to look. So find your forever pieces at jennikayne.com. The listeners are going to get 15% off your first order when you use Chava at the checkout. That's 15% off your first order, JENNIKAYNE.com, promo code Chava, and let getting dressed be one less thing that you have to worry about. All right, I'm going to dive into the Q&A. I know that I talked about a lot today. I actually really love these deep dive episodes. I know I did one other one and I can't even remember what I talked about. I know I talked about like a few different things in like 15-minute segments, but my pregnancy brain this time around has been like next level. Like dangerous. Like I can't tell you how many times I've gone to like heat up leftovers on the stove for lunch, and I turn it on and completely forget. Like I sit down to do work on my computer or whatever, and then like 30 minutes later, I've burnt the crap out of everything. And I'm like, holy crap, Liz, like get it together. Like I legit have to check the burners before I leave the house and make sure that the oven's off because my brain is next level. I mean, I definitely think pregnancy is part of it. But also like I've just been adding new tasks to my life right now, like coming out with this webinar and launching my course and like really putting like when I have a spare minute without the kids. So if I'm warming up lunch for myself and I somehow got both girls to nap, I'm like, oh, great. Now I have some time to just sit down on my computer and get a little bit of work done. And then I completely forget that I'm making lunch for myself. I'm just gonna have to tell myself like cold foods only until this is done. For lunch, and then I don't know why I took on sourdough. I'm like, I'm going to start making my own sourdough bread. It is delicious. It's amazing. I've also made sourdough discard muffins and crackers and cookies and brownies, and it's all been so good. However, I have to feed the sourdough starter every single day, and I'm making messes and cleaning them up. And it's just like one more thing that I added onto my plate that I really don't need right now, but now I'm in it and I can't turn back. So I have dreams. Last night I had a dream about sourdough. Like I was feeding my starter, and yeah, I just like when I start doing new tasks, then I dream about it and I toss and turn, and I'm like, why am I adding so much to my plate right now in pregnancy? I know why I'm adding the course to my plate because it's been a goal of mine for 2 years to get it done. And I really want something that has all the options for you in pregnancy that you can go through, very comprehensible, come out with an amazing birth plan on the other side, then even have the option to talk to me about it one-on-one after you've talked to your provider, tweak things, anything like that. But to have this birth plan prep course that's available and affordable for you guys. Because I'm so passionate about options in birth. And I want you to know yours. Like I want you to know yours. It doesn't matter that you want an epidural or not. It doesn't matter like those types of things because there's other things that continually come up that you don't know about. And that's what I'm constantly learning from my clients is like, I didn't know that this would be presented. I didn't know that they were going to say that. I didn't know that we were going to take this route or this thing was going to change or that like, I didn't get my epidural in time. The epidural wasn't working for me. Like your epidural might not work. What are you going to do then? There's things like that. And there's also different pain relief options. That's not the only one. So I want you to know these things so that you are empowered and equipped. And if you saw, I just did a live on Instagram with Chris Sirach, who was just on the podcast. Or no, sorry, I posted something with him. I did a live with Aaron Steinberg, who was on the podcast a while ago, with baby proofing your relationship. And I was sharing some research that we know the benefits of doulas through research, but those benefits don't just apply to doulas. They also apply if you have a partner who has a little bit of birth knowledge and a little bit, They know, yeah. If you have a birth partner who has a little bit of knowledge, you also reap those benefits. So you don't necessarily have to hire a doula. And as a doula, I'm like, yes, get a doula, but you don't necessarily have to hire a doula to reap those benefits. If you have a birthing partner with you who is a little bit educated, who knows your birth plan, and who is kind of informed on what's going on, you don't have to know everything. You don't have to have the full doula training, but it shows that that gives you those benefits. Research shows that you'll have higher satisfaction in birth, lower C-section rate, lower intervention rate. So if you can get your partner to like do this course, or your partner to just like have a little bit of knowledge, you might not necessarily have to pay for a doula, but you can still reap those benefits and have the birth that you want. So that's why I'm doing this, and why my brain is like completely fried right now. And I'm like, I can't tell you how many times I've been like in a conversation with Vito, and I'm like, I no longer know what I was talking about or what I was going to say. So out the door. Pregnancy brain on top of life brain, I guess, is happening right now. All right, I'm going to go through the Q&A. Let's see, I got to pull it back up on my phone. I had it on here, but then it left. Okay. So I will start with, how do you handle nutrition and exercise with both pregnancy and postpartum? So I've learned a lot about nutrition over the last year and a half. And it's mostly from following accounts on Instagram, which somebody else asked on here, like, what are your favorite accounts to follow, or podcasts to listen to? One of my favorite accounts to follow for nutrition is ttc.pregnancy. Wait, trying to conceive. No, sorry, ttc.nutritionist. It's Sophia Pavia, who came on the podcast before, but we didn't talk about nutrition. We talked about finding the right provider, and she is amazing. I've learned a lot from her. I've learned a lot from listening to the podcast. Are You Menstrual? That's a great podcast. Freely Rooted is a great podcast, and both the I can't think of their names right now. Both the hosts of that podcast have great Instagram handles as well for like nutrition. And when I was listening to Sophia's podcast once, she said something that I was like, holy crap. And I may have said it on here since, that your quote unquote fittest size might not be your most fertile size. And I think we kind of have in our mind that we need to like look this certain way, and especially postpartum. And that is not a time to diet, to restrict yourself. You actually need more calories when you're breastfeeding versus in pregnancy. So I handle nutrition with just really focusing on nutrient dense foods. Every single day, I aim for 100 grams of protein. I aim for, I just posted a reel about like what I drink in a day. Replenishing mineral stores is really, really vital. So having a pinch of sea salt, even just in water, helps replace trace minerals over time. We're not getting the minerals that we need from food because our soil is depleted, and it is affecting our nutrient stores as well. So 100 grams of protein, staying hydrated, and then focusing on nutrient dense foods. I also eat a fermented food every day, usually sauerkraut, sometimes kimchi, or adding in a little bit of apple cider vinegar as a tea with lemon and honey, or mixing it with a little bit of water, drinking it before a meal. And each meal, trying to just balance fat, protein, carb. I don't count calories. I don't even understand what macros is. When people are like, oh yeah, get your macros in. I don't know what that means. It honestly, I have no desire to really learn what that means. But if I'm going to have a piece of fruit, I make sure that I have a little bit of protein. Even if it is like, hey, I'm eating a peach, I'm just going to grab a string cheese, something like that. So every single snack that I have, I also try to have a little bit of protein, a little bit of fat. I never just like really have just fruit or something like that. I always pair it with like a protein or a fat source as well. And now I've been trying to do that with my kids, which sometimes they're like, no, I just want to eat the entire bowl of grapes and not have a string cheese or not have whatever. And I'm like, whatever. So I think that that's really important. Exercise in pregnancy, I would say that I'm probably exercising more this pregnancy than I have in the past. And even then, it hasn't been all the time or consistent, which I would like to do more of. Again, I'm just like trying to plan this course and trying to do my podcast and parenting. It's like, holy crap, like when do people have time to do this? But every time I work out, I feel so good. I'm actually using the Expected and Empowered app. They have pregnancy and postpartum, and it goes off of your gestation or how many weeks postpartum you are. And they have really great workouts in there. Before I did that, I was just doing the Peloton workouts, usually the weight ones. I don't really like cycle. Going for walks. I think with postpartum, again, it's not one of those things. To me, I've never been like, I have to get back to exercising. It's more focusing on core breath postpartum. So when you're going to get out of bed, something you can do now in pregnancy is every time you go to get up, engage your core and then stand up. And that's going to be your thing, like in postpartum too, like taking deep core breaths, tightening your core, releasing it. Same with like your pelvic floor. But finding people who really focus on this is important. Caitlin Dana, she came on the podcast before. Her Instagram account, I believe, is just her name, Caitlin Dana, and she talks about this type of stuff. And Expecting and Empowered, Mama Stay Fit. Those accounts are really great for this. I think it's exercise. I mean, you can't deny that exercise is good for you. And that can be like triggering for some people to hear because we're busy, right? Like when they're like, you need to be exercising. And it's like, okay, when? Like I'm exhausted. However, lifting weights is one of the best things you can do for your health, over cardio, over anything else. It builds strong bones for the long run. So walking and lifting weights would be the two things that I highly recommend. Don't just start lifting weights if you haven't done it before, you don't know proper form, but those are really good in pregnancy and postpartum. Preparing your body to get ready for another pregnancy, like when you're trying so soon. So again, this is where I really focused on nutrient stores. I knew when Doula was 1 year old, we wanted to start trying again. And it is recommended that you wait 18 months to 2 years to try in between pregnancies. And I do think that's probably the ideal length. However, because we want a big family and I'm getting closer to my later 30s, we just didn't want to wait that long. We've also had miscarriages, so we didn't know how long it would take, and things like that. So when Doula was about 6 months old, I started really prioritizing sleep, and I started really prioritizing my nutrient stores. So getting in at least 30 grams of protein at breakfast. So that was marked off the list. Prioritizing getting protein in every snack, every meal. And those were the first two things that I worked on. So I would say replenishing nutrient stores is vital. If you're going to be having kids back to back, don't get off of your prenatal. Stay on it. Again, I recommend Needed. They have the pill form and the powder form. I'll put my link and discount code in the show notes, but they're such an amazing company. And I have to be honest, I don't even take it every single day. I eat pretty well. So like some days I take a few pills, because it's 8 pills a day. Sometimes I take a few pills and sometimes I take all of them. And some days I forget. But because I know that I'm taking such a high quality prenatal, I'm not like as worried. And because I know I'm doing pretty well with nutrition, I'm not like crazy worried. However, I should probably be more consistent at it. I also take an organ meat supplement as well. So I think it's by Paleo Valley. And it's just a organ meat supplement that I add in as well to get those vital nutrients from organ meats that we don't necessarily get from other foods, or that it's really hard to consume from other foods, or it's hard to consume from organ meats because they're not always the best tasting. So I would say really focusing on nutrient gaps, nourishing yourself. Sleep again can be a triggering thing. So it's like, just get more sleep. And it's like, haha, okay, like that works. But again, I made it a priority to be in bed by 10 every single night, even if that meant that things weren't done. I'm like, you know what? I'm going to have to finish cleaning this thing another day. Like, sorry, I have to go to bed. And that has helped. My sleep has been crappy lately, I think mostly because of my pregnancy, but yeah. Any hunches on baby 3's gender? I think it's a girl. I didn't really have a hunch with either one. I said girl, but that's because also everybody was saying boy, and I hate going along with what everybody's saying. And I'm like, no, this baby's going to surprise you all and be a girl. I think this one's a girl too. Is Jovi hoping for another sister or brother? Is Doula old enough to understand? Jovi goes back and forth, but pretty much she wants a sister. And Doula has no idea what's going on. But Joey's like, yeah, a little sister, and we'll name her Moana, or we'll name her Elsa. So she's excited for that. Tailbone pain with second pregnancy, yoga every day, and chiropractic care once a week. Ooh, that sounds painful. I would maybe go to pelvic floor therapy. See if you can get a referral for pelvic floor therapy. It sucks because, like, as with everything, it's hard to find a good one. Like, it's hard to find a good therapist. It's hard to find a good chiropractor. It's hard to find a good pelvic floor therapist. But if you can find a good pelvic floor therapist, that might be able to help with your tailbone pain, because they're going to help you strengthen areas around it to take pressure off of your tailbone. And that could be very beneficial. How and when do you have time for your podcast and content creating? It's a great question. It's a Sunday afternoon right now, so Vito's hanging out with the girls. I would love for today to just be a family day where I don't have to work, but I didn't have time to podcast this week. I did podcast with other guests, because right now, like in the next 2 weeks, I have 14 recordings. So I'm also trying to build up content for when I go on maternity leave. So I just try to fit it in. I really don't work late at night though. I'm not like, hey, I'm putting the kids to bed and then I'm working on my computer. Very rarely. Like, if I have a couple of things to do, I'll do it, but very rarely am I like staying up late, or I try to do it during nap time. With podcast stuff, that's what I was doing. However, then the next question is like, who helps you with the kids since Vito works full time? I would imagine that you would need to have a sitter or some type of support when you're interviewing people. So we actually just got babysitters for the summer. Actually, I mean, not even for the summer. I have childcare for 6 weeks, but for 2 days for 4 hours each day. So on Wednesdays and Thursdays for 4 hours each day. So 8 hours a week. For 6 weeks, I have childcare, just so I could work on pumping out this course and my webinar and other things that I want to get out there and get to you guys. I also want to get the course out before I have the baby, so then I can tweak anything that needs to be tweaked, update. I can't wait to have your guys' feedback on it. I'm going to have a great like discount code for you to try it out and give me all of the feedback, which I'm excited for, and get all of those kinks worked out before the baby comes. So I do have 2 babysitters, one on Wednesday for 4 hours, one on Thursdays for 4 hours. It's not enough. Like, I'm finding that pretty much any downtime I have right now, I'm on my computer trying to learn stuff. I've never done this before. So I'm like, holy crap, how do I do this? And like hours researching things. But before that, my mother-in-law would watch the girls when I did interviews. So, because I would normally just do 1 or 2 podcasts a week. So it'd be an hour here, an hour there. She lives 5 minutes from us. So she would come watch the girls, or I'd go over there and she would help out. And then whenever my parents were in town, it was really easy because they're just here. So I'd be like, all right, I'm going to go in the other room and do some work. So it's great to have family support, like 1,000%. And I'm so grateful that we have that. Just over the summer while I'm doing this course, we just needed like a little bit extra. So got a little bit of childcare. Is Jovi potty trained? If so, how did it go? Jovi is potty trained. You know what? It was actually a really long process. So we started like when she was 18 months old. So I had an interview on here about elimination communication, which I don't think really fits me or where I'm at in life right now. I think it's a really cool concept and it's great to learn about, and especially for people who want to do it. But we did do like a slow adaptive way. So when she was 18 months old, we had like the little potty out and we'd put her on it and do different things. And we caught her first, I have like the picture of when we caught her first poop in the toilet. She was probably like around that age. So it was like just really slowly introducing it. Actually, it was like she was probably 16 months. And then around 2, we did it like a little bit more hardcore. So it was just like more just like offering it all the time. And all of that. I'm really grateful she never had trouble pooping on the toilet. Like she was never scared to poop on the toilet like some kids are. But it was really slow. I'd say it was like a year process. And then by the time she was 2.5, she was fully potty trained. I think also just having the 2 kids so close together, it got hard because then there'd be days where like she would just like pee her pants every day. And I'm like, okay, I'm not doing this anymore. Like I'm just putting you in diapers. Like I'm already changing Doula's diapers. Like I can't right now. But then finally we did it. Then I was just like, no, like we're not doing any more diapers. You're going in the potty every day. And she did, like around 2.5, she did it. So it was a really slow process. And we've actually started with Doula. So Doula's 16 months old. I caught her first poop in the toilet the other day. She did not like it. Like she like had half pooped and then I sat her on the toilet and I was so excited. And then she was like, oh, like squeezed it off and didn't keep going. But we did put like our little toilet out, which we actually got from, I think her name's Andrea, the lady who did the elimination communication. I bought the little tiny toilet from her. I put that out the other day and she was diaper free walking around and she peed in it. So she went in it. We've showed her how, but since that's happened, if I try to sit her on her, she's like, no, she does not want it. But we're just like exposing her. Like she's seeing all of us go to the bathroom and the toilet all the time. We are a family who leaves the doors open. So she sees everybody peeing and pooping all the time. So I feel like her getting exposed to it, and it's like, oh, they do this. Like I want to do it too. So we have the little toilet out for her. I do give her some diaper free time every day. However, that has not been in my favor a lot. She pooped on the floor the other day, which was totally my fault though. Like I, again, like went to do something quick on my computer or to check something. She went outside the gate like that I normally have blocked off and just like pooped on the floor. And I was like, cool. So yeah, I mean, it went with Jovi, it went well. It was like a very slow, drawn out process. And that's kind of how I see things with Doula being too. We're just going to start exposing her to it now. And then around 2, get like a little more hardcore about it. But yeah, I mean, I'm not a potty training expert. I have no research or solid advice around that for anybody. So favorite books or podcasts besides your own, and favorite Instagram accounts to follow. So I feel like I've dropped a lot of Instagram accounts in here. So make sure you go follow all of those. I mean, I have tons of Instagram accounts. If you just go to who I follow a lot of like homeopathic doctors. I follow a lot of midwives. I follow a lot of, just probably more like holistic minded practitioners and things like that. Dietitians. I follow a ton of dietitians for pregnancy, postpartum, trying to conceive, just because I've learned so much. And I'm like, oh, wow, like that's just really great information and that I can refer people to as well. Favorite books. So one of my favorite books of all time is The Alchemist. I love the book, The Alchemist. I've read it a few times. Actually, the last time I read it was on my honeymoon. It's so good. I also love The 4 Agreements. So none of these are birthy books, but The 4 Agreements is so good. The Untethered Soul. I'm trying to think. I feel like I haven't read a book for pleasure in a long time. A spiritual book that I like is Sinners in the Hands of a Loving God. That one's really good because I feel like it's based off of a sermon that was done a long time ago called Sinners in the Hands of I don't remember, hateful God. It was something like that. Sinners in the Hands of a Hateful God or something like that. And that's very much the mindset that I was taught and grew up with. But this book talks about God's character, like being a loving God. And I feel like that's always what I've related more to versus like what I was taught. And so that's a really great book if you're a Christian and into spirituality. I'm trying to think. For birth, it totally depends on like which way you're going here, but I'm totally getting into Dr. Sarah Wickman's work. She breaks down a ton of research. I highly recommend following her. I'm actually including one of her articles in the show notes about routine inductions in healthy women and how it's not supported by evidence. So she's amazing. She actually lives in the UK, but she like studies research. That's what she does. And became passionate about doing it in birth because she saw how women were being treated and everything like that. So she's amazing. Anything that she comes out with, I'm like, I need to buy her book. Man, I'm trying to think. I have so many on like my Amazon wish list that I haven't had time to listen to. I used to love, what was it called? One of Brene Brown's books about shame, which was crazy because when my husband and I met, like when we first met, we were both reading this book and we didn't know that the other one was reading it. But her work is always really, really great, getting to the root of, she talks a lot about shame. And I mean, I think that that's really, really prevalent in our culture and in our society, and just, yeah, and how we live. So, trying to think of what else. I don't know. If I think of anything else, I'll let you know. For birthing, Birth Without Fear, anything by Ina May. I love, oh my gosh, what's it? The First 40 Days, Eating for Pregnancy, anything by Lily Nichols is great. Dr. Jolene Brighton's work, Elisa Vitti. There's a ton of authors that I definitely really, really love. And then podcasts, I'm actually going to pull up my podcast on my phone so that I can just tell you guys what I listen to. Tons of birthing podcasts, obviously. The Are You Menstrual podcast, Birthing Instincts with Dr. Stu and Midwife Bliss. Dr. Stu came on and talked about breech birth. He's an OBGYN and he's just amazing. Like, I don't agree with everything everybody says or like their views on certain things, but he also practiced in hospitals for a very long time, and pretty much anything in the birthing world that he says, I completely agree with. He's just awesome. The Evidence-Based Birth podcast. I can't believe I didn't think of that. I refer everybody to the Evidence-Based Birth podcast, their Instagram account. You can literally go to their podcast, scroll and look up anything that you want to learn about. You can even go to Google and say evidence-based birth, big baby. And they're going to pull up their podcast, their research papers on it, everything. And they're going to break down the evidence on having a big baby, or having your water broken, or induction, things like that. Such a great podcast. Fertility Friday, Lisa Hendrickson Jack was on the podcast before. She's amazing. The Informed Pregnancy podcast with Dr. Berlin. He's great. The Wellness Mama podcast, the Freely Rooted podcast. Let's see. The Long Haul podcast, if you guys don't listen to mine and Vito's podcasts, which we hardly have time to do. And then again, a spiritual one that's really great is Heaven in Your Home with Francie Winslow. It's all about sex and marriage, which is really, really great. If you start at the beginning, her stuff is awesome. And I feel like there was one more spiritual one on here that I really loved. I feel like some of these changed the cover. Oh, The Place We Find Ourselves. That's a great podcast. That is a Christian podcast that just really dives deep into like a lot of different things. So I would also recommend starting at the very beginning with that one as well, because it's really good. So that's all my favorites right now. I know that I'm forgetting tons of things, I'm sure. But I just want to thank you guys for listening, for diving in on this podcast about a couple of reasons why you may need an induction. Again, it's not limited to those reasons. You also deserve to know all the information. I didn't present every single fact here today. So do your own research. If you are in one of these categories, you deserve to have all the information to assess your own risks and things like that. But those are 2 reasons to have medically induced labors. If you have any questions, again, always reach out to me. I love hearing from you guys. I love getting feedback. I want to thank you to the people who left reviews, screenshotted it, sent it to me. I sent them gift cards this week. So if you want to get a gift card, leave a review on the podcast, screenshot it, send it to me, and I will send you a gift card of your choice of either Starbucks, Target, and I'm having a brain fart because I'm pregnant, so I can't even think of what the last one is. So there's a third option. Oh, Amazon. But yeah, my mind is, I've already explained it. I can't function properly right now. So make sure that you guys reach out to me, leave reviews, let me know what you want to hear on the podcast, and I will do my best to make that happen. All right. I will talk to you next week.